Very
Please
good
proceed.
evening to everyone. I am presenting our poster, which is titled as Prevalence and Outcome of Frailty in Older Patients with Cancer, a prospective study from Geriatric Oncology Clinic. So, frailty is a state of vulnerability which is characterized by poor resolution of homeostasis following a stressor event, which could also include initiation of chemotherapy and or surgery. And data on the prevalence and outcome of frailty and in older cancer patients from India is limited, and we aimed to establish the prevalence and effects of frailty among older patients with cancer. So it was an observational study conducted which included older cancer patients who were evaluated in our geriatric oncology clinic with survival data between June 2018 to October 2021. For the assessment of frailty, we used Rockwood's clinical frailty scale, and Kaplan-Meier survival estimation and Cox proportional hazard model were used to perform survival analysis. So this is the clinical frailty scale. We see that patients can be categorized based on their performance from 1 to 9. The individuals from 1, 2, 3, and 4 for the purpose of the study were considered as non-frail, and those with a score of 5 or above were considered to be frail. So we had included 766 patients were assessed or evaluated in our clinic. Out of them, 231 had to be excluded as they either did not have frailty assessment or survival data. So a total of 535 individuals were included. There was no significant difference between the frail and non-frail group. There was no significant difference in age or gender. But we found that around 42% of them had a slower gait speed compared to the non-frail group. The frail group had a lower G8 score, which is a screening tool. The median score was 9 compared to 12 in the non-frail group. They had a higher score in the VES, which is Vulnerable Elders Survey 13, and they were more likely to have cognitive impairment. We found that nearly 22% of them had cognitive impairment when compared to only 7% in the non-frail group, and the caregiver burden was also high among the patients who were frail. We used the CARG score tool to assess the risk of chemotoxicity, and we found that nearly 51% of them who were frail had a high risk of developing chemotoxicity, grade 3 to 5 toxicity, compared to only 28% in the non-frail group. The overall median survival in the non-frail group was 12.2 months, whereas in the frail group was 6.9, and this was statistically significantly different with the hazards ratio of 1.95 with a 91.5 confidence interval of 1.45 to 2.66. So to conclude, prevalence of frailty among older cancer patients is 47%. It is associated with poor physical, cognitive, as well as psychological resilience, and increased risk of chemo-related toxicity, and associated with poor overall survival. Our findings supports the routine assessment of frailty in older cancer patients to guide treatment decisions. Thank you, sir.